Hey folks, welcome to the Brown Bag. Really thought I would be not doing this anymore, but here we are. And the news gets more and more interesting. So anyways, as usual, this will be on Zoom. So if you would like the Zoom link, please DM me. This is also on Facebook Live. You can watch that right now or later. I'll also be uploading this to my YouTube channel. I've been better at that. If you need a link to that, please let me know. It's called No, I Won't Look at Your Mole, inside Epi Jokes. So yes, I have been. Just about every epidemiologist has been asked that at some point. So anyways, yeah, if you have any questions, please throw it up in the chat. Otherwise, if you're on Facebook, put it under comments or just speak up. I'm more than happy to answer any questions as we move on. So today, I apologize. I have to, this is going to be a little bit shorter than usual. I'm trying to limit to about an hour, 15 minutes from this point on, just because it's very long. So, and I have to also pick up my wife from the airport. So anyways, so let's go, let's get with the news. Let's look at the numbers. Globally, we're not really in a good place. We're better than, back in May when India was having its surge, but we've plateaued and now looks like numbers are increasing again at a relatively high level. So we are not anywhere close to being over this. Yes, the 14-day change, there was a 1% change in the last 14 days. Deaths are a little bit better news, but there's some areas that are struggling mightily. Let's take a look at what areas they are. South America continues to struggle, but there is some good news coming out of South America in recent days, at least some regions of South America. South Africa remains a huge concern right now. Numbers continue to increase in many African countries. The UK remains a concern. The US progress has been halted, and there's some indications that we are going to possibly see a surge. I do know that in Utah, we are in the midst of a little bit of a surge. I will talk about that a little bit. Russia is going through a bit of a surge, Spain and Portugal as well. And Indonesia is going through a surge, as well as Bangladesh. So there are regions around the world that are seeing some not insignificant numbers by continent. So you can see that Asia, after some significant declines because of the declines in the Indian outbreak, we're now seeing some increases again, mostly driven by countries like Bangladesh, Indonesia. So we are seeing an uptick in cases again. Europe, we're definitely seeing an uptick, mostly driven by the UK, but also some worrying signs in Portugal and Spain. I know I mentioned Africa numbers have now exceeded North American numbers. So this is actually a count on just a number of new cases. Africa now has more cases than North America. And that's largely not necessarily due to North American numbers getting better, but African numbers getting worse. You can see that I apologize. That should be South America, not South Africa. My apologies. South America continues to do poorly, but their numbers are actually getting a little bit better. So there's some good news. I apologize. I didn't have that on here. I put in South Africa instead of South America. Oops. From in the top 25, as far as number of cases per day, Brazil remains number one, but numbers have gotten a little bit better there. Then India. Shoot, I put in Africa there. I should not have. I was just looking at countries, not necessarily continents, so I apologize for that. Then Colombia, Indonesia, I mentioned Indonesia numbers are getting pretty bad. Russia numbers are getting bad. The UK, South Africa, again, some surges there. The US is actually down quite a bit. I think we're outside of the top 10, which is Wow. So now don't let that fool you, because the US numbers are showing some signs that we're very least plateauing, and there are some states that are seeing some surges. Um, and then you got Iran, Bangladesh, I mentioned, their numbers are getting bad again. And then again, you notice that the South American numbers aren't quite as bad as in previous weeks. So there's some good news coming out of there. On a per capita level, South America still remains the worst hit continent, but Africa, especially the southern part of Africa, but really all of Africa at this point, are seeing some worrying numbers. Mongolia continues to struggle. I mentioned the UK, Spain, and Russia, and then Indonesia as well. So you can see South America still, so there's some good news here. There's looks like the number of cases per million has plateaued and is now starting to drop. We'll see if that's can be sustained. South American numbers have been highly, highly unstable. You can see that it goes up and down relatively quickly. So we'll have to see if this is a continuing trend or if it's going to just plateau or increase again. You can see Europe's numbers have now starting to increase. North American numbers, again, you can see that it is actually starting to increase as well. Africa's, you're seeing the increase in Africa, even Oceania, Australia and New Zealand are struggling a bit. So overall, even as South American numbers go down, the rest of the world seems to be looking at some increasing numbers. So overall, globally, not great news. The progress we've made in the last, especially since the Indian pandemic started to decline, we're starting to lose that. And we're seeing some increases in not just in one area either. It's all the continents, South America, North America, Asia, Africa, Europe, and even Australia and New Zealand. So yeah. So you can see from a per million, so per capita standpoint, daily new cases per million, Namibia is now #1. So that's really highly concerning, given that Namibia is a relatively poor country with limited infrastructure. They've, to this date, done a great job of keeping numbers down, especially since they border with South Africa, and South Africa has struggled on and off throughout the pandemic. But things have caught up with Namibia. They're seeing a significant surge, approaching 1,000 cases per million, which is, to me, kind of the level that borders on very, very serious. Colombia is second. Colombia is the one country in South America is not showing positive numbers. And given the political upheaval there, it's some bad news in Colombia right now. Mongolia continues to struggle. That's just, from what I understand, what little news coming out of Mongolia is just due to mixed messages, policy issues. They have a very high level of vaccination, but again, they've recently ramped it up, and I keep saying vaccination campaigns aren't going to have immediate effects on a surge. You're going to see effects of a vaccination campaign maybe months after you start it. So then Argentina, Kuwait is seeing some increasing numbers. Oman, that Middle Eastern region has seen some increasing numbers as well. And again, it's kind of curious given that a lot of those, especially the wealthy oil-rich Emirates, have had high degrees, very, very active vaccination programs. But given the types of vaccines that they've been using and the fact that there's a lot of disparities in vaccination in that region, particularly with guest workers, it's not surprising that they're seeing some surges still, even with some of those countries having 50-60% of their population vaccinated. And throw in Delta, we're talking about maybe 100, maybe 120% more transmissible than the original wild type variant. Again, even if you have 60% of your population vaccinated, 40% remains unvaccinated. That's enough to create surges with a highly transmissible variant. That's what you're seeing. See, the UK is up here now. So the UK surge is pretty serious, and we're going to talk about that because, again, I'm not focusing in on the UK because I'm being Eurocentric. It's because they have the best data. It gives us the most insight into Delta and the effects of the vaccine on Delta. I would talk about the African countries more, but just a dearth of data coming out of Africa makes it really hard to draw any sort of solid conclusions. That, and of course, that and the fact that Africa is very poorly vaccinated right now, and that's, of course, a huge issue. So that's why I'm focusing on South Africa, the UK, rather than other countries, because the quality of the data right now, particularly in terms of Delta and the vaccines, it's some really great data. And the UK has, of course, a solid public health system, I would argue, and great data, even better than the US because of the nature of the UK healthcare system. Israel, I'd like to look at some Israeli numbers as well, but right now their numbers, they're seeing a little bit of a surge, but not to the degree that the UK is. So their numbers are more sparse. I'll talk about both the UK and Israel in a little bit. As far as countries that have seen changes, you can see Australia and New Zealand have seen an increase. Indonesia's numbers are looking bad. Myanmar, what you can gather from the data, again, Myanmar data is really highly unreliable, but they're seeing a surge. All of Southeast Asia actually is seeing a bit of a surge. Russia, I mentioned, Kazakhstan. So some of these Central Asian countries are seeing a surge. Africa, of course, is seeing a surge. Cuba, Finland, the UK. So it's all over the world. It's not just, in the previous few months, it was India or it was South America. It is all the continents now. Delta is now spread to all of the continents. It will quickly become the predominant variant because that's how evolution works. You get a variant that is 60% more transmissible. That's a huge advantage. It's going to be the predominant variant if it hasn't established itself already in just about all over the world. So in a few months, we won't even be talking about alpha. We won't be talking about beta, gamma. It'll be all Delta all the time. Unless another variant pops up, which is always possible. Okay. In terms of countries seeing significant surges, this is a percentage change. So these aren't absolute changes. These are relative changes. I know if those of you taking epi from me, I always emphasize the difference between relative and absolute, and I would prefer to have absolute numbers here, but I don't have access to that data. So anyways, Kosovo has seen an 800% increase in the number of new cases in 1 week. Eastern European countries, yeah, they've struggled, and with the exception of a few countries, vaccination campaigns haven't really ramped up. So they are still very susceptible to surges. One other point I want to make, I know a lot of folks are saying, well, Eastern Europe has really, really struggled, which means that there's a high degree of natural immunity in places like Bosnia, Serbia, the Czech Republic, Slovakia. These are countries that really got hammered early. So there is a fair degree of natural immunity in those populations. However, there is increasing evidence that natural immunity, especially to the wild type variant, the original variant, is less protective against Delta. We're trying to, so really, there's an easy solution to this: vaccination. Again, and the vaccines, particularly the Pfizer and Moderna, and now some more evidence that AstraZeneca and Johnson & Johnson even are highly, highly effective against the Delta variant. So what we're trying to encourage people to do who've had COVID early is to get vaccinated anyways, and preferably with the 2 doses. I know they're trying to talk about maybe those folks who've had COVID can just get that vaccinated with 1 dose, but I really don't see any harm in getting both doses, even if you've had prior infection. That should, again, protect them almost fully against the Delta variant. But it's hard to get folks, they'll say, well, I've had it, I'm protected. Well, with variants, that's all up in the air. So there is increasing evidence. So even in places with high degrees of natural immunity are susceptible to surges with Delta, okay, unless they get vaccinated. Right. Israel's seen a 100% increase. Again, in absolute numbers, this isn't a lot. We're talking about 200, 250 cases a day, which is about half of what we have in Utah right now. But it's still, they were down to single digits for a while. So this is a concern. Again, driven by Delta in the unvaccinated population. Now, there was some statements made by the health minister of Israel that implied that 50% of all the case, it basically said 50% of all cases are in the unvaccinated, are vaccinated. And that was really highly misleading and quite honestly, really irresponsible to make flippant remarks like that. I think just about it. I know that your local epidemiologist had a nice little post about that base rate bias. But it was, I just, I read that and the minister didn't seem sure. They're just throwing up numbers and then kind of throw in, I have to check those numbers. Given the nature of Delta, given the nature of this pandemic, public health officials have got to be careful what they say. I've been answering questions about that statement for a while now. Everybody's been asking, oh my God, breakthrough cases. It's totally bypassing the vaccines. Delta variant's totally bypassing that. No, it's not. No, it's not. The really solid data around Delta and the vaccines comes out of the UK, and it's really good data. And I talked about it last week. I'll talk about it a little bit again this week, just to reemphasize, the vaccines are working against Delta. What the surges you're seeing is mostly in the unvaccinated. But anyways, back to this. So you can see that, there are some countries seeing some significant surges, but keep in mind, these are relative. So if you go from 2 cases, if you go from 10 cases per million to 30 cases per million, that's a 200% increase. So you have to be aware of that. But it is still concerning. The UK, 70% increase, Cuba, 65% increase. So, and also what's really concerning is a lot of countries we haven't seen on this list before. Mozambique, Zimbabwe, Malawi, Togo, Cote d'Ivoire, Somalia. So a lot of African countries are showing up here. And that's really, really concerning, given that they don't have access to vaccines. And these are countries that have just been hammered economically, but done a great job of controlling it, and they're just running out of resources at this point. And they don't have the infrastructure to handle a huge surge in cases. Already, we're seeing oxygen shortages and healthcare, just overwhelmed hospitals. So this is a huge concern in Africa right now. So just to kind of highlight some of these different regions, again, South American numbers have been so unstable, going up and down. Really like to see more long-term trends, because you can see that Colombia, Uruguay went down, and I have reason to think that Uruguay's numbers are real, given that they've really ramped up their vaccination campaign, and so maybe you're starting to finally see the effects of their vaccination campaign. We'll see. Again, they've been so unstable that I'd like to see some more long-term trends. Like I said, most countries, Argentina went up a little bit, now started to go down. Again, unstable numbers. Brazil's numbers, again, they are still at this high, very steady level of transmission, and nothing's really changing in Brazil. And given the Brazilian government, I don't really expect much changes, quite honestly. But overall, the trend is positive in that most of the countries are seeing declining numbers, with the exception of Colombia. Colombia's numbers are climbing, and now Colombia now has the highest per capita rate of new infections in South America. So really concerning. East Asia, actually, Japan is actually seeing a little bit of a surge. Same with South Korea. Olympics are in a few weeks. Boy, y'all know my opinions about this. The Japanese really screwed up. They should have been emphasizing vaccines from the very early on, and they may have been able to get away with it, but boy, with Delta floating around. Mongolia numbers, though, positive, and they are starting to go down again. Hopefully, they continue to go down. But again, there's a lot of instability in Mongolian numbers. Malaysia numbers were going down. They're going back up again. Indonesia's numbers are quickly going up. Thailand is seeing a bit of a surge, almost matching Indonesia numbers. Philippines is kind of stabilized, but at a higher level. You can see Myanmar's number, and Vietnam. Of all the countries in Southeast Asia, Vietnam's probably done the best in controlling their pandemic. But again, they need access to vaccines. They can only do this for so long. Southeast Asia, Sri Lanka's numbers are improving, but Bangladesh, do I have not? Shoot, I didn't put in Bangladesh. I know Bangladesh numbers are increasing. It's a bit of a concern. Their numbers are going up again. Indian numbers are starting to stabilize a bit, a little bit earlier than I'd like to see it. Bhutan numbers continue to kind of stay at a relatively high level. Pakistan's doing okay, but numbers out of Pakistan are a bit unstable right now, so it's hard to say. Bit unreliable, I should say. The Middle Eastern countries, again, they continue to struggle. I threw in some Central Asian countries. I don't know where to put them. Georgia and Kyrgyzstan, you can see Kyrgyzstan and Kazakhstan are seeing some increasing numbers. Again, driven by Delta. These are countries that also have very low vaccination rates. Okay, so right now, any country that has low vaccination rates is highly susceptible to Delta. Even in countries that had high level of natural immunity, they're highly susceptible to surges by Delta. And again, the tools that they've been using, social, isolation, shutdowns, social distancing, masks, all of those are slightly less effective because Delta is more transmissible. But so biologically less effective. However, politically and socially, they're even less effective because, again, I keep emphasizing this, that those are tools that are good for a short-term period. Once you start going 5, 6, 7, 8 months, they become less effective just because people don't want to do it anymore. The exception even masks become less effective, especially in countries like the US that have a strong anti-mask sentiment. They become less effective. They may be effective for a while, but they become less effective. They become less socially acceptable. Economically, the damage it just keeps getting worse and worse. So really the solution here is we got to get vaccines out. To me, that's the stage 2 of a response to a pandemic. Is one, the traditional public health tools to stop the spread, flatten the curve. I know I haven't said that in a while. Flatten that curve, keep numbers low. Meantime, develop vaccines and treatments. And we just, we did that in the US, but the rest of the world did not see the benefits of that. See Australia's numbers. That outbreak in Sydney, it just keeps going. It doesn't take much to start an outbreak in a country that has seen almost no cases. It doesn't take much. Again, they got complacent. Even countries that do a good job, they need to go to this next stage, which is vaccination. Again, these are countries that really have no excuse. given that they are extremely wealthy, they could have gotten the vaccines. They could have, while they were while they were enjoying this low level of spread, they could have been getting ready for that next stage. Instead, they got complacent. And again, New Zealand, Australia, Taiwan, Japan, South Korea, all guilty of this. The African numbers, really quite concerning. Namibia's numbers are really high. Tunisia's numbers are starting to skyrocket. South Africa's numbers have gotten bad again. Botswana, by the way, these are all just this year. I'm just to make the graphs a little bit less busy. Zambia, Botswana. So mostly in that southern African region, but it is all of Africa. And again, I want to emphasize, with a few exceptions, African data is highly unreliable. These are countries with quite honestly, underdeveloped public health infrastructure and public health data infrastructure. So, places like Niger, Chad, Democratic Republic of the Congo, just those numbers are, by all indications, they are increasing, but they're going to be highly unreliable. But I would say that South Africa is really highly reliable numbers. Namibia seems to, Tunisia does as well. Zimbabwe, not quite sure. Rwanda, I know, has a very good system. Uganda as well. So it's all over Africa. It's not just the southern part of Africa anymore. And so we'll keep an eye on those numbers as throughout the next coming weeks. In Europe, again, you can see that it's not just the UK now. You're seeing increases in Spain, Russia, and Portugal as well, all driven by Delta. Russia's struggling. And again, they have a domestic vaccine, but there's a high degree of distrust in Russia. And given the form of government, there's just very low trust of public institutions in Russia. And so you have a surge in Russia as well. Central America, Costa Rican numbers are starting to go down, but plateauing. Mexico numbers are just so unreliable. Again, it doesn't match up with their death rates. They are underreporting to a significant degree. Guatemala, Honduras, they're doing better as of late, but Cuba's numbers and Panama's numbers are now increasing. Cuba's, it's very steep. Again, Cuba doesn't have access to vaccines. I know they're trying to develop their own vaccine, but these are hard to, the Cuban healthcare system is excellent. They have a great public health system, but it's concerning. And then, of course, North America, US, and Canada. Canada numbers continue to do better. There was a time when Canada was doing worse than us. Well, that lasted about a month, 2 months. Now, it looks like US numbers are starting to flatten out. Now, again, Canada they have a high degree, significant percentage of their population has one dose. Hesitancy in Canada is much less than the US. However, it's one dose. They are doing that strategy of one dose to everybody before worrying about the second dose. What we know about Delta is that one dose is not at all effective against Delta. Even with Pfizer, I think it's like 30% effectiveness, whereas with the Alpha variant, it was 50% efficacy. So Canada does remain susceptible and sensitive to surges with Delta. As far as deaths, better news. Deaths are declining. You can see that deaths on a daily level are now declined back to November levels. Could that increase? Yes, because if you see a surge in places like the UK or the US, we're probably not going to see a concurrent surge in deaths because of our vaccination campaign. It focused on those at most risk for death and serious symptoms. And it's going to affect young people who are just less likely to die and go be in the hospital from COVID. However, all bets are off when we talk about Africa or any of these other countries with low levels of vaccination. They haven't even been able to vaccinate their frontline medical workers, much less seniors. So we could start seeing surges in deaths, just like we did in India. So we'll see. Again, something to keep an eye on. As far as the number of deaths, Brazil leads the way along with India. You can see that Russia is definitely going through a surge. Most of South America is. You can see South America, as far as deaths, leads the way. Asia's second, then Europe, North America. Africa's really catching up to North America, and it may catch up to North America in the coming weeks. And then Australia and New Zealand. As far as confirmed deaths, Brazil still leads the way. India is now second. Colombia is third. At the rate those Indian numbers are declining and Colombia numbers are increasing, Colombia may have a chance to be number second in the next few weeks. Russia, you can see there's fourth, Argentina fifth, Indonesia sixth. US is pretty far down now. We're at seventh. You can see 254 deaths per day now. And again, I don't expect in the US for those deaths to really increase significantly like we saw over the winter because of our vaccination campaign. Even if we do see surges, and I can talk about how big these surges may look, we have some idea now, given what's going on in the UK. I don't think we'll see a concurrent increases in deaths. Hospitalizations, it'll be less. Hospitalizations will be less as well, given who the surges are going to be in less susceptible populations. As deaths per million people, southern part of Africa as well as South America still leads this list. South America by far, I mean, you're looking at a fairly high level of mortality in South America still, even with the good news. Europe, you've seen a little bit of an uptick. They're second. North America's third, Asia fourth, Africa's fifth. One thing about Africa that may prevent the deaths from getting really high is the fact that Africa is a very young continent. So when you see surges, most of the surge, it's going to be mostly young people, just because Africa is a much younger continent. So the death numbers may not get as high as, say, in Europe or South America, which are much older populations. So something to keep in mind. None of these are age adjusted. So as far as countries, Paraguay is still struggling. Namibia is second. So they're really struggling. Then Colombia, Argentina, you can see, again, South American countries are dominating this list. Romania is struggling a bit. Oman, so a few Middle Eastern countries, African countries. You can see that these are all mostly in low to middle income countries, which also tend to be, I mean, these are mostly in low to middle income countries, again, with very low levels of vaccination, which isn't surprising. And this is even though a lot of these countries have very young populations. So again, Namibia, you can see it's second, but really in actuality, it's worse than that because this is in a population that skews much younger than even the South American countries. So when you see numbers, when you see African countries up here, consider that it's actually worse than it seems because these are much younger countries. As far as deaths, increase in deaths, you can see Colombia, a few Central American countries, mostly in Asia and Africa, though. You can see Africa, and even West African countries are starting to be affected. Sierra Leone saw a 700% increase in deaths. Kosovo, Myanmar, Guinea, Senegal. So again, dominated by African countries. So you can see that, African countries where we were seeing the really significant increases: Sierra Leone, Guinea, Senegal, Nigeria, Namibia, Rwanda, Zimbabwe, Mozambique. This list goes on and on. Again, these are countries that can ill afford this. They just don't have the medical facilities, nor the budget to be able to take, to have advanced care, to be able to have advanced clinical care for serious COVID cases. They just don't have that. They barely have enough oxygen. So I haven't revisited the case fatality data in a while. So you can see the case fatality data. Yemen leads the way again. Yemen's a bit of an outlier because they have so many other problems in Yemen. But then Peru, Mexico, some of this may be due to underreporting of cases, so it might be artificially high. I suspect that's what's going on with Peru and Mexico. Sudan, Syria, again, exacerbated by ongoing conflict as well, creating a lot of highly at-risk population. China's high numbers are driven by the early days of the pandemic, but you can see the list here. Taiwan also, this is interesting. Taiwan has a really high case fatality. Again, that they haven't had a lot of cases, so there's not a lot of deaths, just a handful of deaths. So that's kind of interesting. As far as vaccinations, we're now above 3 billion, but from a, so we're approaching 40 doses per 100 people. Well, of course, we need 200 doses per 100 people for full vaccination with 2-dose vaccines. So we still have a long ways to go. And what's, of course, the real issue is how unequitably this is distributed. Iceland still leads the way. They have more than 70%, close to 75% of the population with 1 dose. And they're approaching 60% with 2 doses. So if you want to avoid a Delta surge, Iceland might be the place to go. Canada started, their 2nd dose is starting to catch up now. So that's good news for Canada. In fact, the percentage of their population with 2 doses now almost equals the US. Not quite, but still 30%, they're getting up there. And again, there's less hesitancy in Canada. So, my guess is that, they'll be able to hit 70% fully vaccinated by the fall at the rate they're going. So that's good news. The UK, again, this is the concern. We're seeing a huge surge in the UK, even though they have close to 50% of their population fully vaccinated. And they have close to 70% with at least 1 dose. So anyways, so this is why that 2-dose, that fully vaccinated data point is becoming more important. Okay. If we can see a surge the size that we're seeing in the UK, all of these countries really are still susceptible to surges with Delta. Now, that's what transmission does. Even though, say in Iceland, you got 60% with 2 doses, that's 40% of the population that is at higher risk for Delta. With a less transmissible disease, 40% of the population, if 60% of the population is immune, that may be enough to control it. But with a far more transmissible disease, like the Delta variant of COVID, you may need 70, 80% of that population fully vaccinated and immune to be able to control it. And remember, natural immunity is far less protective. That's the evidence that's coming out right now. Natural immunity is far less protective against Delta unless they get vaccinated. So you can't count on that natural immunity anymore. As far as continent Asia still dominates, this is largely driven by China and India really ramping up their vaccination campaign. North America slowed down. This is the tragedy, of course. Africa is not seeing any vaccines at all. So the upper middle income countries, that's China and India really dominating this. Lower middle income countries, low income countries, it's not much going on there. Particularly the low income countries, they're getting nothing. And you can see just the number, this is number of doses. So the upper middle income countries, largely driven by India and China, really dominating the doses administered. The high income countries, well, higher income countries, we've been vaccinated from a very early point. We're getting to a point where we're just reaching hesitancy, so we're not vaccinating as much. But the low middle income countries and the low income countries, that's where we're just not doing enough. Let's talk about the UK bit. This is a fairly significant surge. We're 20,000 cases a day. So we're talking about, back in February, equivalent to back in February. This right here was, once they really ramped up their vaccination campaign. And we're hoping that this would just continue, except Delta showed up. Just remember, the UK has a high degree of vaccination too. So that's why this is concerning. Test positivity is now approaching 2%. It's above 1%. It's about 1.5%. And the test positivity, I do trust in the UK because UK still actively screens their population. So this is much more trustworthy than, say, in the US, where number of tests are just really abysmally low. So this is a real surge. However, there is some good news here in that, yes, hospitalizations have increased, but not very much. Not very much. And most of the hospitalizations you're seeing are younger people. That's going to be the important takeaway point here. It's younger people who are less likely to be hospitalized. And that's why we're seeing less hospitalizations. Of course, they're still susceptible to severe symptoms and death. And of course, long COVID can show up even in asymptomatic cases. So that's still a concern, but that is some good news. In ICU, same thing. Slightly increase, but not a huge increase. In deaths, we haven't seen any sort of increase in death. Now, that could be just a lag. We might start seeing an increase in the next week or so, but I'm thinking that we're not going to see much. If we see any, it's not going to be much at all. Why? Because, again, the surge is mostly in young people. And I'll come back to this study because, again, this is really good data. This is why I'm really focused on the UK, because the quality of data coming out of the UK in terms of COVID, instead of Delta, and as well as vaccines, the best data is coming out of the UK right now. And this gives us a lot of insight into what is going to happen in the US, what is going to happen in other countries in terms of Delta. So again, round 11 was back in, this is really great. There's 12 rounds of this. Every 2-3 weeks, the UK samples about 10 to 15,000 of its citizens, sends them diagnostic tests, self-administered diagnostic tests, gets demographic info, and comes out with this data. So it's a survey, it's a prevalent survey of COVID. So what's nice about this is it is not just symptomatic, not just hospitalizations, okay? These are folks that we are getting asymptomatic cases as well. So a good baseline of infection prevalence in the general population. It's well randomized, fairly high participation rate. So really good data. So round 11, so they've done 12 rounds of this ever since they started vaccinations. Round 11 was back before Delta was the predominant variant. It was Alpha. This was back, I think, late April, early May. Round 12 was late May, early June. That's when Delta predominates. So you can see Delta, the difference between Alpha and Delta between round 11 and round 12. So this is really useful to try to characterize this surge, this recent surge. You can see by the time round 12 came out, 80-90% of all new cases were Delta as opposed to Alpha. So this gives us an idea, the difference between Alpha and Delta, what is driving this surge, and the impact of vaccination. So I'm going to skip over these. Okay, we already saw that. This is the one that I want to really show you. One thing I discovered with the UK is that the UK still has not approved the Pfizer for 12 to 15 year olds. Just discovered this. I didn't realize that. They still have not. They have their attitude is their philosophy is they need to immunize many of their high risk populations first before getting to low risk, 12 to 15 year olds. So keep that in mind. Now, so no one under the age of 16 is vaccinated in the UK. I just discovered this. But again, this is the difference between round 11 and round 12. You can see, so if there's no difference between round 11 and round 12, means that those age groups, there's not much going on. So, the 65 to 74 year age group, there's not much going on. In fact, round 12, there's fewer cases. Round 75 plus, there's a slight increase, but that's margin of error. 55, 64, slight increase, margin of error. 45 to 54, a little bit of a jump. 35 to 44, again, margin of error. In the 25 to 34 age group, actually, there's not much going on at all. In fact, it's declined for round 12. It's the younger age groups that's really driving this surge. And the data, more and more data comes out, indicates that this surge is mostly younger people. So very similar to that surge we saw in Michigan earlier on in the US. This is mostly younger folks driving this. Why? Because younger folks, number one, those under the age of 16 aren't vaccinated. So they're highly susceptible, especially to a very transmissible variant, especially given that most social distancing has been relaxed. I'll show you some individual cases of that. Number two, for those who are eligible, they're much less likely to be vaccinated. So, you know, the 18 to 24, that age group is really, really not likely to be vaccinated. And that's true of the US. This is the challenge right now, is get that age group vaccinated. And it's been really hard, mostly because of just no urgency. They feel like they're less susceptible. It's not a big deal. So we're having a hard time convincing this population to get vaccinated. Also, these are the folks who are, again, out of convenience. They're probably more likely to be in jobs that don't offer time off to get their second vaccine, or to get their vaccines, or to stay home for side effects. So they're not doing this. They're not getting vaccinated. Also, this data, again, there's some unknowns, but you can see the general trend here. So in the less than 65, vaccinated 2 doses, the prevalence is about 0.07%. And the unvaccinated is 0.23%. Same thing with over 65 and the unvaccinated. No, there's no cases in the unvaccinated. Wow, all right. So let's focus on the less than 65. This may be because over 65 in the UK, there's so much vaccination there. So many people vaccinated. So you can see, look at the numbers. Unvaccinated was only 855 in the sample. In the vaccinated, 2 doses are 23,000. So that's just numbers here. So not really, I mean, but again, you know, you look at even in the vaccinated 2 dose, the prevalence is actually less than the less than 65 vaccinated 2 doses. So it's good news. But here, this is the one you want to look at, 0.23 versus 0.07. So the surge in the UK is driven by younger people, unvaccinated. If you are vaccinated, you are still safe, relatively safe. Is it more dangerous right now given a surge? Yes. Anytime there's a surge of cases, more virus in the unvaccinated is going to increase the risk of breakthrough infections. So it is you're at a slightly higher risk now, even if you're vaccinated, because of the amount of virus that's circulating in the unvaccinated. But not to the degree, but it's real danger here to these surges is among the unvaccinated. Luckily, in countries like the UK and the US, there's an easy solution. Vaccinate. Easier said than done, of course. So yeah, the vaccines are still highly effective. Is there a slight decline in efficacy? Yes, but really not much. We're still talking about upper 80s, low 90s efficacy. I still remember in the early days of vaccine development, we were all hoping, oh, I hope this new vaccine is at least 55, 60% effective. And then Pfizer and Moderna came out and just hit it out of the ballpark. They're still highly effective. Case in point, Scotland, 2,000 cases, and they have pretty robust contact tracing still. 2,000 cases were traced to football because the Scottish team, I guess in the Euro Cup, was doing really well. And there's this game against England. Scotland has its, remember, the UK is really a bunch of 4 countries mashed together: Wales, England, Scotland, and Northern Ireland. And they're all very patriotic on the way. Quite honestly, I expect Scotland and Northern Ireland to become independent of England and Wales at some point in my lifetime. It's going to happen. It's already almost happened with Scotland. And I think Northern Ireland, Yeah, well, with Brexit, politics, but yeah. So anyways, who goes to football matches? Younger people, mostly men, least likely to be vaccinated. Men in their 20s, least likely to be vaccinated, and that's what's driving this surge. So you got relaxed social distancing with large events like a football match, much more transmissible variant, unvaccinated, got 2,000 cases. Yeah, that's what's happening. So when you see surges like this, just know that it's mostly in the unvaccinated. Now, again, ignore the data, ignore the news out of Israel, some really bad data based on really bad data saying that, oh my gosh, half the cases are in the vaccinated. I'll get to that in a second. What that means. So in the UK, anyways, the UK, yeah, they're actually talking about, so this is, they just came out with an interim report just a few days ago about strategies for booster shots in the fall. And it's not a bad idea. Okay, just to, you know, even though there's data coming out, again, immunogenicity data saying that the mRNA vaccines may last years, I think mostly it's for the folks who maybe got the Johnson & Johnson or AstraZeneca. Might not be a bad idea to get those booster shots. Now, again, Israel numbers are not, I mean, they're not super high. We're talking about 250 cases. Okay, in a country that is far more populous than Utah. So we're not talking about a huge amount, but, you know, again, relatively speaking, yeah, they were down to less than, you know, they were in this, I think 20, 30 per 20 or 30 a day. So this is a little bit of a surge. Again, there was this, I mean, yeah, so you can see a little bit of a surge there. Nothing compared to what they were experiencing early in the winter, where they had close to 9,000 cases a day. But still, given that, you know, 60% plus of their population has both doses, and almost all of it from Pfizer, a very highly effective vaccine, that's a concern. And then you have saying, oh, 50% of new cases, Delta. Okay, here's the thing. Say you had 4 cases in a cluster, 4 cases, you know, or 6 cases or 10 cases in a cluster, and 5 of them were vaccinated. That does not mean that the vaccine is only 50% effective. It's called base rate bias. What you have to do is take those 10 people, those 5 people who were vaccinated and got and were a breakthrough case, and divide that over the total population of vaccinated. Get the 5 unvaccinated folks, divide that over the total population of unvaccinated, then you can calculate efficacy. So, real problem with this statement. He was really flippant about it, and he even said, you know, I can't remember if it was he or she. They said that up to 50% of new cases are vaccinated. That all that does is get people really, really worked up. It's not based on good epidemiology. It's just horrible risk communication. Not thrilled with that statement. And I've been answering questions about that forever. People like, oh my God, did you hear what's going on in Israel? So many breakthrough cases. All these cases are breakthrough. The other thing you have to remember is that there are a lot fewer unvaccinated folks in Israel than there are in most of the other parts of the world. So you may get more in terms of just count. You may get more breakthrough cases just because there's so many people who have vaccinated. It's just, again, similar to this right here. You know, you think, oh my gosh, and in the unvaccinated, there were 0 positive cases, and in the vaccinated, there's 13. And people might say, oh my God, the vaccine causes COVID based on those numbers. Till you look at the details. Unvaccinated, there were only 855 people. vaccinated to 23,000 people. Basic epi. Something that the health minister, I would have thought would know about. Anyways. Vaccination rates, so they've responded and they've actually increased vaccination among the 12 to 15-year-olds. So a lot of Israeli teens are starting to get vaccinated, but in certain communities, particularly Orthodox Jewish communities and Arab communities, for various reasons, they're not getting vaccinated. And this is kind of the same thing that's happening here. We have the anti-vaxxers, and unfortunately, ultra-Orthodox community tend to be a little bit less science-based. Sounds a lot like some of the folks that are not getting vaccinated in this country. Also, Arab communities, of course, are very marginalized and very little trust in public institutions. Sounds a lot like our country. So Israel has some of the same issues that we have in terms of trying to get these very difficult populations vaccinated. Oh boy. Okay. So I'm running out of time again because, yeah. Anyways, US. Let's look at the US really quickly. We plateaued, slight increase, 5% increase in the last 14 days. Doesn't seem like much, but again, we're a big country. We're having issues is Missouri, Arkansas, bit of a surge there, Utah, Wyoming. That's where we're seeing the surges. The deep south is starting to see some surges. Is it a coincidence that these states also tend to have very low vaccination rates? No, it's not a coincidence at all. Let's look at the numbers. Florida leads the way in terms of numbers. They've seen an increase. Texas has seen an increase. California started seeing an increase. Missouri is the one I'm concerned about, along with Arkansas and some of these other states. Utah as well. Utah's now in this list as well. And this is counts. If you look at per capita, Utah is in the top 10, 1, 2, 3, 4, actually top 5 of states. So we're 5th, actually, just behind Wyoming. Never want to be just behind Wyoming on this list. Sorry for those folks in Wyoming, but Wyoming's public health is, well, Wyoming's, it's not the public health folks, of course. They're awesome. In fact, they're more awesome because they're trying to practice good public health in a state that doesn't believe in public health. Ups the degree of difficulty quite a bit. So those of you who are practicing public health in Idaho, Wyoming, Montana, the deep south, kudos to you, because those are states where practicing public health is much more difficult than, say, a place like, say, Vermont. Anyways, you can see that. Yeah, so again, coincidence that these are the states with relatively low vaccination levels? No, not at all. Utah's kind of a bit of an outlier because Utah's vaccination numbers aren't horrible. I know people think that, but it's not horrible. If you adjust it for age, it's not bad. We're kind of middle of the pack. Could we do better? Yes, but we're not like Idaho or Alabama levels. Yeah, not to insult these individual states, but that's what the data says. All right. This is the other end, of course. These are the states that are doing extraordinarily well in terms of per capita. Vermont and Massachusetts, less than 1 per 100,000. That's awesome. Maryland as well. You got South Dakota, which is a bit of an outlier because they actually have a fairly low vaccination rate. So you can see Vermont, Massachusetts, 62% fully vaccinated. That's the total population. So those are Israeli levels. 56% in Maryland. Puerto Rico actually is ramped up their vaccines. South Dakota is a bit of a outlier here. And then you got Wisconsin, Pennsylvania, again, all in the 50s, upper 50s. You got Connecticut at 61. They're seeing a bit of a surge, but their per capita numbers are really low. So is this coincidence? And you can see these numbers: Nevada, 42%, not bad. Missouri, 39%. Arkansas, 34%. Wyoming, 35%. Utah 37, 35. So again, with the exception of Colorado, which is still the Colorado numbers are still going down from their surge in the last few months. So their numbers aren't, their numbers are getting better. Is this a coincidence? No. As far as the states seeing a surge, Nevada is seeing a fairly serious surge, 114% increase in the last 2 weeks. Arkansas, Mississippi, Nebraska, Missouri, South Dakota's seen a surge, even though they have low per capita numbers. Connecticut's seen a bit of a surge too, even though they're highly vaccinated. South Carolina. So again, vaccination is going to make a difference. In terms of deaths, California leads the way in counts, of course, because of population. But this is interesting. This is death per capita. Look where Utah is. I haven't talked about deaths with you in terms of Utah because Utah's always done really well in terms of deaths because we have a really good healthcare system here and we have a fairly young population. So mortality is from COVID was never really a huge issue in Utah compared to other states, but we're now number 2 or tied for number 1 again with Wyoming. So that's not great at all. Then Missouri, Arizona, South Dakota, Florida, again, tends to be dominated by states with low vaccination levels. So let's look at vaccinations real quick. We're at 181.3 million people. So that's great until you realize we're 3.2 million, 320 million or so, 330 million or so. So you still have a long ways to go. 47% of the total population is fully vaccinated and 54.6 with at least 1 dose. But we're slowing down. We look at just, eligible folks, better. So, we're 55% all ages, but 12 and upwards, 64%, at least 1 dose, and 55% fully vaccinated. And then 18 and up is even better. But again, viruses don't care about age eligibility at all. So, we still need to get those numbers up. Good news here is it looks like the daily doses have increased above 1 million again. That's good. Not nearly as good as when we were getting 4 million doses a day, but still, it's still good that we're vaccinating a little bit more. I'm not quite sure what's causing that, quite honestly. Maybe it's kids getting out of school. So the 12 to 15-year-olds getting out of school. And so they're getting vaccinated now. I don't know. It's hard to say. As far as states, New England, the Northeast has done phenomenally well. Those are countries that are approaching, if not exceeding, Israeli levels of vaccination with full 2 doses. Okay. Now, also remember that almost all of our doses administered in the U.S. are Pfizer or Moderna. Those are highly, highly effective. Okay. Yes, Johnson & Johnson's there. There is some data coming out of Johnson & Johnson saying that they are effective against Delta, but we'll get to that in a bit. Sorry, my robot vacuum. It's noisy. Anyways, yeah, East Coast, West Coast is also doing pretty well. The upper Midwest is generally doing okay. New Mexico's a bit of an outlier in this region, but the deep South, as well as Idaho and Wyoming, are not doing well at all in terms of vaccination. That hasn't changed much, fully vaccinated as well. You can see just vast regions of Missouri and Arkansas. By the way, excuse me, you should overlay this with this. Not unexpected. And then you can look at Colorado too. The western region of Colorado is a lot like Utah in terms of just hesitancy. And so, yeah, that's where we're going to see the surges. And also Alabama, Mississippi, Louisiana, we're starting to see surges there. Texas, Florida. You see a trend here. What's going to happen, I think, is we're going to see a surge in Delta, just like the UK has. It's inevitable. Delta is quickly becoming the predominant strain in the US. I have some Utah data to show you. It is quickly becoming the predominant strain in the US. The UK, even with its high vaccination level, saw a surge. But again, it's in people who are not vaccinated, in younger people. Okay. Therefore, we will see surges of Delta, but it is going to be very, very unequal. Northeast, West Coast, if we see surges, they'll be minimal. But we may see surges there. Remember, UK has almost the same level of vaccination as Massachusetts and New York, yet it's still seeing surges. So we may see surges. But what I'm really worried about is regions of the country like here, the Deep South, Arkansas, Missouri, Idaho, Wyoming, the Dakotas, Texas, regions where we have very low vaccination rates. And even within states like Utah, where we have high and low vaccination rates, we're going to see surges, and they're going to be in areas with low levels of vaccination. Okay. Now, again, I want to emphasize, even in those regions with low levels of vaccination, the vaccination rates in over 65 is relatively high. So we're not going to, so these are probably going to be driven by younger people, just like in the UK. So folks in their 20s and 30s are going to probably drive this, which means that hospitalizations probably won't be as high, nor will deaths, especially compared to last winter. But we will see surges, especially given the lack of really any social distancing or restrictions or even mask wearing that we're seeing right now. So again, you look at some of these numbers, given at least one shot, Vermont and Massachusetts and Hawaii are over 70% now. It's phenomenal. Vermont is 66% fully vaccinated. Meanwhile, Mississippi is 36% with one dose, only 30% fully vaccinated. Again, most of them are older, so most of the younger folks in Mississippi are completely unvaccinated, which makes them susceptible, especially when you have a variant that is 120% more transmissible than the original variant. We're going to see surges in those areas. Even if we start vaccinating now, again, vaccination campaigns take a while. We'll probably most likely see a mid to late summer surge in those areas. Some of them may be fairly significant. Will it be as significant as over the winter? Probably not. We have seasonality helping us. But we also have complete lack of any sort of restrictions. Mask wearing is almost non-existent, especially in these states. So we're going to see surges. And in Utah, we already are. We'll get to the Utah numbers in a bit. So broken down by age groups, by the way, I just want to throw this in there because Utah does not do that badly when we start adjusting for age and the fact that we have the youngest population in the US. Mississippi, though, holy cow. Idaho doesn't look like they've vaccinated any of their 12 to 17-year-olds. Mississippi, 10%. Meanwhile, Hawaii is vaccinated 57%. Vermont, 65% of their 12 to 17. This is the age group that's going to drive this next surge, and we see it. And it's going to be in these states. Good job, JC, with the wine. I know it's all you. Anyways. Sorry, excuse me 1 second. Stupid vacuum. Anyways. So yeah. There's some states doing extraordinarily well, and they're going to be well prepared. And we'll start talking about the fall, but fall we start losing the advantage that we have in seasonality as fall goes to winter. What is that going to look like? unless we can really get that vaccination level up, we're gonna see surges in the winter. But again, the people being affected are going to be different. Here are the states that have reached to 70%. We're not going to reach 70% because July 4th is already obviously around the corner, but there are several states who have reached that. These are the states that will not see significant surges. If they see surges, okay, they're going to do okay. Wyoming, North Dakota, Mississippi, Idaho. These are states that probably, I mean, Mississippi, Wyoming, North Dakota, they may never reach 70% of adults. So this may actually not be. So these are the dates that they are projected to reach that point. Utah is actually relatively close. So again, Utah vaccination isn't as bad as everybody thinks. We have actually a fairly positive vaccination culture here. Not as bad as the South. So that's my take on Delta in the US. Given what we're seeing in the UK, takeaway message is that the vaccines are highly effective. If you're vaccinated, your risk is extremely low. Is it higher than before? Yes, of course. Breakthrough infections happen when there's virus circulating in the unvaccinated. So the decision to wear a mask is yours. If you are, say, you live with someone who's immunocompromised or can't get vaccinated, wearing a mask in public is not a bad idea. Because if you have a breakthrough case, and you're probably also transmissible, hopefully less transmissible, but you probably are transmissible. Okay. So number one, vaccines are effective. Number two, for the unvaccinated, this could be an absolute horror show. If we split off the population between vaccinated and unvaccinated, the rates are vastly different. For the unvaccinated, yeah, we are experiencing, for the vaccinated, we're experiencing a really good summer with low numbers. For the unvaccinated, numbers haven't changed much since this winter. It's still bad out there. And it's going to get worse with Delta. And number three, and this is the more important thing, I think, unless we can get the level. So, a lot of folks say, well, hey, unvaccinated, that's the consequence of not vaccinating. They're more susceptible to disease. I'm protected. I did the right thing. Here's the problem, though. Again, like I mentioned before, the more viruses circulating in the unvaccinated population, the more likely breakthrough infections happen. That's just basic disease ecology. Okay. And of course, there are those who can't get vaccinated for various reasons, for legitimate reasons. Yes, I'm saying that the decision not to get vaccinated because of politics or conspiracy theories is not a legitimate reason. For legitimate reasons, because they're immunocompromised, for various medical reasons, they should be protected, but they are not unless we can get the unvaccinated. And then finally, and this is probably the most important point, as long as the virus is circulating at high levels, the more likely variants are going to pop up, more likely that one mutation or a series of mutations pops up on the spike protein or elsewhere on that genome that really can bypass immune response. Now, I have my doubts that that'll occur, just because, just in general, I think the COVID genome is not that complex, and there's only a few places where mutations can occur to create that big of a mutation. I don't know if that'll occur. There's various reasons why I think this, and I may try to describe this in a future post, but I don't know if that'll happen, but still, there is that chance. And the more virus circulates, the more likely that'll happen. Then vaccines become useless, and we're all back to square one. So that's where we're at. I think we're going to see surges late summer. I think we're going to see a surge. See what happens if school opens. That's going to be really interesting. But yeah, don't even get me talking about the Olympics. Okay. I'm not quite sure what you're saying. Was mute?
We couldn't Oh, I didn't hear you anything.
Oh, can you all hear me?
Now, yes, but the
Yes.
last information wasn't. I don't know about another people.
Did everybody else, am I breaking up here or anybody? Okay, so might be Deja, you might have a bad connection. I don't know.
Maybe, maybe.
Yeah, because you're kind of breaking up when you speak, but you kind of break up too. So, okay.
Oh, okay.
So Utah, let's talk about Utah. We're definitely seeing an increase. Oh, thank you, Brian. Definitely seeing an increase. Yeah, we hit over 500. I don't know if today's numbers are out yet. Kind of curious. Let me check. 430 cases. So it's still high. We're still at a high level. Test positivity is up. Hospitalizations have increased slightly. The mortality is a little concerning. So we are seeing a surge. Okay, but I'll show you the hotspots in a second. So you can see that the Wasatch County, Wasatch Front counties are all seeing about a 20 to 30% increase, with the exception of Weber. Washington saw 130% increase. And then you have some rural counties with significant increases: San Juan County, Millard County, et cetera, et cetera. So we're seeing an overall surge here in the state of Utah. And this is per capita. You can see Uinta County is now #1 per capita, 33 per 100,000. Then Juab County, Millard, Carbon County, Iron, Duchesne, Tooele, Weber's up here. But yeah, luckily the per capita rates in the Wasatch Front counties are relatively low. Weber County is at 16, Davis at 12, Utah at 12. And Salt Lake County actually is in the lower end at 10 per 100,000. So that's good news. It looks like this surge here is mostly not in Salt Lake. You see the increases here. It's sorted by increase. You got San Juan with a huge increase, Millard, St. Pete, Sevier. So you can see most of the big increases are in rural counties. And again, rural counties with relatively low levels of vaccination. Hospitalization has increased quite a bit in Utah as well. Again, by all indications, this is in the unvaccinated population. So this is the details on the cases. So you can see definitely an upswing. Not huge yet, but it has the potential to. My wife asked me, what do you expect? I wouldn't be surprised if we hit 1,000 before we, at the peak of this little surge. 1,000 cases per day. Definitely going backwards. Given the level of vaccination within the state, I might be wrong. I'm hoping I'm wrong. Because of the high levels of vaccination in the most populous counties, we may avoid that. The thing about the rural Utah counties is that there's just not that many people. You know, most folks are in the Wasatch Front. So even though they have low levels of vaccination, we might not see a huge surge in those counties. Just because, well, there's just not as many people there. We'll see. Test positivities definitely just went skyrocketing up. So yeah, even with fewer tests, the number of positives have gone up. So this is definitely a real surge here. Hospitalizations have also gone up a little bit, not as much. And again, I don't expect hospitalizations to go up to the levels that we saw over the winter. Again, because of the nature of our vaccination campaign, most of the folks who are at high risk for this have been vaccinated. Now, Utah's done a really great job. So this is now part of the coronavirus.utah.gov interface, reporting on variants of interest. Again, what's frightening is how quickly Delta has established itself as the predominant variant. You can see the orange is Delta, the green is Alpha. Alpha can't hold a candle to Delta. Delta's kicking its butt. And you can see on the daily level. So again, it just over the last month, Delta is just taking over. Yeah. So as far as vaccinations are concerned, we're just going really slowly. It's kind of, yeah. This is over 12. All Utahns at over 12. 61% with at least one dose. Terrible, but we're not going to hit 70% of all adults. No, we're not going to hit that goal yet. We got a ways to go. And quite honestly, with Delta, I don't think 70% is nearly enough, quite honestly. I think we got to shoot for something higher. The more transmissible disease, the higher the percentage of the population has to be vaccinated. This is the bad news. Of course, the number of vaccines administered in the state of Utah continues to decline. We're approaching just about 5,000 doses a day. Wow, compared to a peak of 45,000. Hardcore hesitancy, folks. That's what we're hitting. As far as vaccination, Summit County leads the way, 58% by far. Then Salt Lake County, Grand County has done well with their vaccination, but they're still seeing a surge. A bit of an outlier, but I think part of it is because of just so many people going down to Grand County on vacation, particularly in the spring. Yeah, and then Juab County at all, robust 23%. As far as the age groups that are lagging, it's the younger age groups. Again, you know, this is why I don't expect a huge surge in hospitalizations, because the older populations that are fairly high level of vaccination, it's this younger crowd here. You know, the 12 to 18, as well as the 19 to 29, 30 to 39. These are the folks that are going to, if we see a surge, and we are seeing a surge, these are the folks who are going to dominate these surges. Okay. As far as breakthrough, again, state of Utah is doing a great job of reporting breakthrough infections. You can see last calculations, quick calculations I did, we're looking at about an 85, 86% effectiveness, I should say, with the vaccines, which is about on par with the data reported out of the UK, and what we know about Delta with the Pfizer and the J&J vaccine. So not bad. It's still, again, it's you can see that for this orange line is among the unvaccinated, this green is among the fully vaccinated. Yes, it is slightly higher for the unvaccinated, for the fully vaccinated, because there's more virus circulating. So we expect more breakthrough infections. But this is much higher. Among the unvaccinated, it's getting bad. Among the unvaccinated, we're talking about levels we haven't seen since last February. So this is again, like in the UK, like everywhere else, we're seeing these surges. It is driven by the unvaccinated. This is case instance per 100,000 people in small areas, so smaller than the county. And I like to do this because, you know, Salt Lake County, there's a lot of little small areas. And so the darker the color, the higher the daily incidence. This is vaccination rates by small area. Put those two together. Yeah, it's not perfect, of course. Grand County has fairly high levels of vaccination, but still have high transmission. Again, driven by tourism, probably. But you can see, you know, you look at the areas with the highest level of transmission tend to be the lowest vaccinated. And this is going to be trend. I'm going to actually download the national data by county. So county vaccination rates and also county transmission rates. I guarantee it's going to be a really good correlation. Just like this. Okay. Few other bits of news. Johnson & Johnson just released this is an immunogenicity study. Okay, so 2 ways to determine the efficacy of a vaccine. Ultimately, you have to have epidemiologic data, clinical trial data, observational data to determine the efficacy and the effectiveness of a vaccine. So you have to have human-based data. You have to have people getting the vaccine and getting the disease or not getting the disease to determine those numbers. That's ultimately, that's what you need to do to determine efficacy and effectiveness of a vaccine. However, that's not always possible to do very quickly. So we have immunogenicity studies. Now, those are not necessarily human. So these are lab-based studies. You take people with the vaccine and then you determine the level of immune response they have to their the vaccine. So through blood tests to determine antibody levels and so on. Now, that sounds way fancier, but from an efficacy standpoint, this is not conclusive data. It does lend evidence to whether a vaccine is effective or not, but ultimately you have to do those human-based studies to determine efficacy. So with Johnson & Johnson, there's been very little data, human-based data on how effective is it against Delta, mainly because number one, we haven't had a lot of cases of Delta yet. That's changing. And number two, by far, most people in places like the UK or the US have been vaccinated with Pfizer, or in the case of the UK, AstraZeneca. Very few people were vaccinated with J&J. So we just haven't had the numbers to determine true efficacy against Delta. This, though, given that situation, the fact that there's very few people vaccinated with J&J, comparatively speaking, and fewer people who vaccinated with J&J who got breakthrough cases, this is the next best thing. And it does show, it seems to show that, at least in the lab, J&J does elicit a robust response against Delta. So that's really good news. We were concerned about Delta, J&J in particular, because we saw the data coming out of with the AstraZeneca trials and the Pfizer trials, AstraZeneca studies and the Pfizer studies in the UK, and how ineffective one dose was against Delta. Of course, Johnson & Johnson is a one-dose vaccine, so that was something that we were concerned about. But this seems to be good news. But again, this is not conclusive until I see human-based data, until I see people with Johnson & Johnson who get breakthrough cases, and we have enough of those folks to draw a conclusion. It's good news, but not conclusive by any stretch. A few other things. Running out of time. This is something that I struggle with. There's a difference between the vaccines, and the difference is even more pronounced with Delta variant. The Pfizer and Moderna well, we don't know about Moderna actually, but Pfizer, we definitely know it's highly effective against Delta. AstraZeneca is slightly less, but still effective, especially with hospitalizations and death. What we know about the Chinese vaccines, however, is very little, and even less with Delta. And there's some evidence that the Chinese vaccines are not very effective against Delta at all. You look at some of these countries with huge surges, even though they have high levels of vaccination, they're still experiencing huge surges. Seychelles, Maldives, most of those countries, those the Gulf Emirates in the Middle East, Chile, Uruguay. These are countries that have high levels of vaccination, mostly with the Chinese vaccine, yet they saw horrific surges. So how effective are these vaccines against Delta? The jury's out, and it's not very good. And the Chinese don't help by not sharing the efficacy data. I just can't find that data. And these countries the Chinese are not willing to share it. So when COVAX says this, I have mixed feelings. Now, COVAX is saying that this is actually an ethical issue. Like, for example, Europe is setting up COVID passports, but only for specific vaccines, typically vaccines that are only administered in wealthy countries. And in fact, when students come to Westminster, that's going to be a challenge. What if we have Chinese students who had Sinopharm? We may ask them to get the Pfizer vaccine. We know that's safe. We know mixing vaccines is safe, but from an ethical standpoint, from a justice standpoint, this is problematic. So in the UK, if you have Sinopharm or Sinovac, or even the Indian version of AstraZeneca, that's not included in the vaccine passport. You would not be allowed. You would not be considered fully vaccinated. And the fact that these vaccines are also correlated to the wealthiest countries, that brings up some really serious ethical issues. But at the same time, the data shows that those are the most effective vaccines. So I'm in a bit of a conundrum here on what to think of this, that we should have equal recognition of vaccines. I gotta think about it more. Maybe I'll mention this next time. Okay, so I showed you the Scottish study showing that 2,000 cases, mostly unvaccinated young men who are young men spreading the disease. Same thing is happening in the US. This is what's going to drive a surge if we see it, is unvaccinated. And again, reducing, look, I know, the mask mandate is problematic because no one's wearing a mask. And I know for a fact that half the people in Utah are non-vaccinated, yet I see zero masks in public. So people are obviously ignoring ignoring the mask, mask recommendations from CDC. Unvaccinated, wear a mask. So that's what's going to drive. Everybody's just about back to normal. And that's a problem because half the people aren't vaccinated and we have Delta running around. And this is a perfect example. 85 teens, staffers in Illinois, got COVID at summer camp because they didn't require masks or check vaccine status. Most of those folks, almost all of them, I think all of them, were unvaccinated. I think there's another one, I think, where I think there was an outbreak. Oh, there was one in Florida in a government office. Everyone got COVID except for the 6 people who were vaccinated. So there's stories about this all over the place. We're going to see a surge. It's going to be in the unvaccinated. So if you're vaccinated, it is still safe. Now, one of the things I've been seeing, and this will be a controversial statement for me. What I've been seeing are people who are just being overly paranoid about COVID. I swear there's some folks who are looking for any excuse to just shut things back down and go back to where we were. There are folks who think that we should go online in the fall because we're seeing this little surge. And they tend to be progressives. And this isn't doing the cause and effect. Again, we've got to be science-based. And the science shows that if you're vaccinated, I fully plan, unless another variant pops up where the vaccines are far less effective, I plan on going out and enjoying myself. I may wear a mask inside if it's a lot of people, but I'm going to teach classes because hopefully we're going to have a vaccine mandate on campus. I'm going to teach classes. Probably not going to wear a mask. So just keep that in mind, that if you are vaccinated, you're relatively safe. And it's ultimately it is a personal decision, but just know that you are very safe if you are vaccinated. Can breakthroughs happen? Yes, but it's really rare. And if a breakthrough does happen, most likely it's going to be very mild. So want to throw that out there because I just see a lot of folks who just, they panic and quite honestly, they say they're science-based, but really they're kind of not, in the opposite direction. And again, it might be the politics entering into things, and that just poisoned everything, even amongst those who are self-avowed science. We're using evidence, we're using science. That little bit of politics gets in, and yeah, I've seen a lot of that. Just like hearing faculty saying, we need to go back online this fall. Hell no. Unless I see data showing that the vaccines are no longer effective, and it was huge surges, far as I know, I hate online teaching. I really do. So just want to throw that out there. I'll probably write up something about that because it is a concern. It is a concern that I've had. Okay. Thank you very much, everyone. I will be back next week because things are, they're really fluid right now. And there's a chance that there's going to be surges, and there's some really interesting numbers coming out of places like Utah, as well as, the deep South. So I will be back next week, talk about the numbers. I'll hopefully be a little bit shorter. If you missed this, I will put this on YouTube. JC, I'm sorry I didn't get a chance to put the link on there. I will post it on my Facebook page. And if you want to email me, I can get that to you as well. So otherwise, I got to go. I got to go pick up my wife at the airport. And otherwise, I will see you next week. If you have any questions, feel free to shoot me a text, email, Facebook message, whatever. I'm more than happy to answer those. So, all right. Otherwise, have a good weekend. Have a good 4th of July. If you live in Utah, please don't use fireworks. And if you're using fireworks in my neighborhood, I will go Karen on you and call the cops. So, all right, because it's dry up here. All right. Otherwise, I will see you all next week.